These are 10 radiology signs that can change management immediately. If you miss these on call, patients can deteriorate quickly. Let's go through them. First, the hyperdense MCA sign. On non-contrast CT, one middle cerebral artery appears hyperdense compared to the other side. This represents acute thromboembolic occlusion. In this case, there is also a large hypodense area in the MCA territory with loss of gray-white differentiation and mass effect with midline shift. Recognizing this early can identify a large vessel stroke requiring urgent intervention. Next, the insular ribbon sign. Look at the lateral margin of the insular cortex. Loss of the normal gray-white interface is one of the earliest signs of MCA infarction. This can be seen within hours of symptom onset. If you miss this, you miss the earliest imaging clue of stroke. Next, the spot sign. On CTA, you see a focus of contrast within a hemorrhage that is not present on the non-contrast scan. That represents active contrast extravasation. This is the spot sign, and it predicts hematoma expansion. In this case, follow-up imaging shows the hemorrhage enlarging. These patients can worsen rapidly and need urgent management. Now let's switch to chest imaging. The deep sulcus sign. In a supine patient, pneumothorax doesn't rise to the apex. Instead, air collects anteriorly and basally. This creates an abnormally deep and lucent costophrenic angle. In this case, that lucent left diaphragm and deep sulcus represent a left pneumothorax. If you don't recognize this sign, you can miss a pneumothorax on trauma imaging. Next, Hampton's hump. This is a peripheral wedge-shaped consolidation. It represents pulmonary infarction from a pulmonary embolism. In this case, it's seen in the right lower lobe with a small pleural effusion. Subtle, but an important clue to PE next, the Oreo cookie sign. On the lateral chest X-ray, you see a dense pericardium with fat density anteriorly and posteriorly. This layered appearance resembles an Oreo cookie. This indicates pericardial thickening or pericardial disease, a subtle but important mediastinal finding. Now let's move to abdominal emergencies. The Rigler sign. You can see both sides of the bowel wall outlined by air. This only happens when there is free intra-abdominal gas. This indicates a perforated viscus. In this case, free air outlines distended small bowel loops. This is a surgical emergency. Next, the Whirl sign. On CT, the mesentery and vessels appear twisted around the superior mesenteric artery. This is the Whirl sign. It indicates volvulus or malrotation with twisting of the bowel. This can lead to ischemia and requires urgent intervention. Now a quick MSK sign, the Scotty dog collar sign. On oblique lumbar spine views, the posterior elements form a Scotty dog. The pars interarticularis forms the neck. If there is a defect, it appears as a lucent break across the neck, like a collar on the dog. This represents a pars fracture, also called spondylolysis. Easy to miss if you don't recognize the pattern. Finally, the water bottle sign. The cardiac silhouette appears globular and enlarged. This is the water bottle sign. It suggests a large pericardial effusion. In the right clinical setting, this can indicate cardiac tamponade, which is life-threatening. These are 10 radiology signs that can change management immediately. If you're on call, recognizing these patterns can make the diagnosis in seconds. Subscribe if you're learning radiology.